Hello, my name is Kayla and today my goal is to help you gain a deeper understanding of type 1 diabetes, which is also sometimes known as juvenile diabetes. Put simply, diabetes mellitus is a disease where the body cannot use glucose normally. This creates a problem because glucose is the main source of energy our body cells need to function. One of our organs, the pancreas, produces the hormone insulin. Insulin causes body cells to take up the glucose found in the bloodstream and store it as glycogen. You can think of it as insulin being the key to the body cells. Glucose needs to enter, but is locked out. Insulin unlocks the door, allowing glucose to enter the cells. In a normal body system, it is produced proportionally to the excess glucose found in the blood. For type 1 diabetics, the glucose no longer produces insulin. For type 2 diabetics, their pancreas produces some insulin, but not enough. Gestational diabetes is when a pregnant woman's pancreas doesn't produce enough insulin to keep her blood glucose levels lowered during pregnancy. Often the diabetes is resolved once the baby is born, and there's less demand in the body for insulin. Type 1 diabetes is often called juvenile diabetes as it is diagnosed usually in the childhood or early teen years. It develops suddenly because of the death of insulin-producing pancreatic beta cells. This is potentially genetic and triggered by environmental factors, though research is still going on. My friend Elizabeth Checkmeister was diagnosed as a type 1 diabetic at age 9. Elizabeth, would you be able to describe for us what your symptoms were at your time of diagnosis? What tipped you and your family off that something was wrong with your body?
Well, in the weeks prior, I began to experience a lot of really drastic mood changes and a lot of hostility and impatience towards people. And I started to be very oddly thirsty all the time, and I'd have to go to the washroom quite frequently. And after about 3 weeks, I think I lost 20 pounds. And my mom she's a nurse, and so she started to realize that there's got to be something wrong here. Yeah.
Wow, this must have been really scary for you guys. What was something that worried you most about having to face life with type 1 diabetes?
Well, I think for the most part, I was just really nervous that I wouldn't be able to be a normal kid, and I wouldn't be able to do the things that my friends could do and my family members could do. But I soon found out that that was a lie, and I could do just as much as they could do, and even more.
Hypoglycemia is the name for when a person's blood sugar is lower than normal. Some typical symptoms would include being nauseous, sweaty, and dizzy. However, diabetes is also a very individual disease, and symptoms would vary from person to person. So for you, Elizabeth, what would you consider a low blood sugar, and what would your symptoms be?
Well, for me, a low blood sugar is anything that is below 4. And my symptoms include dizziness, clamminess, disorientation, distraction, major distraction, and just a lot of confusion. And often I get kind of silly and a little bit crazy.
Okay, so how would you treat this?
Well, I'll typically look for a snack that has 15 to 20 grams in it, so like a juice box.
Grams of what?
Carbohydrates.
Okay.
Yes, carbohydrates. And so I will take this, and then I'll wait 10 minutes, so 10 to 15 minutes, and check again once I feel better. And if it's up, then I'm good to go.
Awesome. So treatment of hypoglycemia is very important. If glucose levels are left to lower, it can progress from confusion and dizziness to the diabetic possibly falling into a coma or suffering from seizures. Hyperglycemia is the opposite condition, where blood sugars rise above normal. Elizabeth, what would you consider a high blood sugar, and what would your symptoms be in this situation?
Well, like you said, it definitely varies from person to person, but for me, anything that is above 8 is sort of my high zone, and I try to stay away from this. And I can detect if I'm high by a feeling of just like sort of claustrophobic, and I get really thirsty, and I have to go to the washroom a lot. I get really moody and really, really drowsy. And typically my symptoms are, you can see them pretty well, so people are good at telling me if I need to have help.
Okay, so what kind of help would you get if you went high?
Well, typically I will enter my blood sugar that's high into my pump, which is right here, and it will calculate how much insulin it needs to give me for however high my blood sugar is, and it will bring me down into my target blood sugar.
Okay. So hyperglycemia is dangerous because the immune system can become compromised, blurred vision can progress into blindness, and even the diabetic's brain can become affected, which leads to seizures and coma. When the sugar becomes stuck in the blood, the body resorts to breaking down fats and then proteins for energy. This manifests as weight loss, even though the person likely is hungry and eating a lot more than usual. The person can also become extremely tired because their body isn't using the glucose as an energy source because of the lack of insulin to allow the glucose into the body's cells. This causes ketones to build up in the urine, and this is called ketoacidosis. This can lead to flu-like symptoms such as a loss of appetite, vomiting, or fever. If not treated, this can become fatal due to the damage of major organs caused by the acid imbalance. Other dangers of hyperglycemia are organ and nerve damage based on the effects on the heart and blood vessels. The chances of coronary artery disease and high blood pressure increase, and the extra sugar can destroy the vessels that supply the nerves. Kidney disease is also a result of high blood glucose levels. Now that we have described symptoms and consequences of hypo and hyperglycemia, it has become clear why treatment and strict maintenance are an important part of a diabetic's life. Glucometers become their constant companions. These are devices used to determine the approximate concentration of glucose in the blood of the diabetic. Would you check your blood for us, Liz?
I would love to.
So she uses this, she pushes a button, and basically a needle stabs her in the finger, and she is able to draw just a small drop of blood, which she then puts onto a strip that she inserts into the glucometer.
Like so.
She then puts the blood, and the strip draws the blood in, and the meter determines the concentration of glucose in her blood.
So my blood count now is 6.1.
Which is in between 4 and 8, so we know that this is in a healthy range, and Elizabeth is good to go. So type 1 diabetics have to give themselves injections of insulin after figuring out the amount that is needed to correct their levels. The body is missing insulin, so they have to use insulin as a treatment. So when you were treating your diabetes with injections, when would you usually give yourself an injection?
Typically I would have 2 needles a day. I would take one in the morning around breakfast time or when I woke up, and then I'd have one in the evening, which would be my supper time injection.
Okay.
And this is excluding the amount of injections I would take for high blood sugars.
So technology is a wonderful thing, and research has produced a device called an insulin pump, which is produced by companies such as Animas and Medtronic. And Elizabeth has a pump. So basically, the diabetic is able to set their basal rate according to their body's needs. This means that the pump releases small amounts of fast-acting insulin between meals and during sleep. This maintains their blood sugar in a similar way to what a pancreas would do if it was functioning healthily. When a diabetic eats, they must bolus, or program the pump's internal computer to deliver sufficient insulin according to the grams of carbohydrates they consume. So do you find that your pump is more or less convenient when treating your diabetes?
I find that it is actually being a huge improvement in my treatment. It's being really, really helpful for me. I do a lot of high activity sports and extra activities, and it's helped me immensely in managing my blood sugar during those activities, and it's been a huge benefit in my life.
Are there any complications that come with having to carry a pump around with you?
Yeah, well, I mean, sometimes it can get a little bit annoying having to carry it around with you all the time, and sometimes you have to constantly be remembering to enter in how much food you're having, or if you're high, you have to remember to put that in your pump, and it all gets programmed so that it can constantly deliver insulin into me, and yeah, but otherwise, it's been extremely beneficial to my life. Yeah.
Now that we've had the chance to talk about the medical and scientific side of diabetes, I'd like to also take a look at the emotional side. Elizabeth, can you tell us about what some feelings were that you experienced as you and your family adjusted to having life with type 1 diabetes?
Well, at first when I found out I was diagnosed, I felt really bitter and resentful, and I didn't really understand much about the disease. But as years passed and I began to cope with the disease, I began to realize that this didn't have to hold me back from life, and I could live a life that was normal and awesome.
Yeah.
Yeah.
So now that you've been living with it for about 8 years, are there emotions that you still struggle with?
Yeah, I still have days where I feel really down and discouraged about it, but I just remind myself that it's okay to have those days, and everyone's got to have times like that in their life. And but for the most part, it's been easier in these past couple of years when I learned to just accept it and live life to the fullest.
How has your family been in helping you cope and adjust?
Oh, they've been huge. When I was first diagnosed, I was really dependent on them because I was so young when I got it, and so they were my primary caregivers for the first couple of years. And then once I began to learn how to have my own independence in the disease, now they're just they're there to support me and to encourage me in pursuing my dreams.
So for those of us who have diabetic friends at school or in extracurricular activities, what advice could you give us on helping you handle the disease?
Well, I would really advise them to keep an open mind when having friends or family members who have diabetes, because we often require a little bit more patience and understanding, and so sometimes when we have higher low blood sugars, we say things that we don't mean. And so it can sometimes just require that little extra bit of understanding. But for the most part, I'd say that it would be important to really stay well educated and to be really adamant in learning more about the disease, because it'll help you help them. And and also keep in mind that we know how to best help ourselves, and the best way to really help us is to just be there.
Awesome, thank you. Diabetes is a very diverse and complicated disease. Treatment is not a perfected formula, but something that has to be fiddled with and adjusted for every individual. While it certainly has challenges, it is very possible for diabetics to be successful in almost any pursuit if they work hard. Animus is a company which produces insulin pumps, and they have an annual tour celebrating diabetic heroes. People who have embraced the challenges that come with having diabetes and done amazing things, and are now inspiring others to do the same. If you are a non-diabetic and you know someone who lives with diabetes, I encourage you to learn more about the disease from them. Hopefully, they will inspire you in the same way Elizabeth has inspired me.